Who is the best candidate for otoplasty? Well, typically otoplasty can be performed on anybody older than 6 or 7 years old, as the ear is almost fully grown at that age. This procedure can be done either under a local anesthetic or a general anesthetic. I perform most of them, even in children, under a local anesthetic. The outcome is not affected by what type of anesthesia we use. We typically like to operate on all of our procedures on healthy patients with no medical problems. Patients have to have realistic expectations as to what can be achieved by an otoplasty. The procedure itself is intended to address the prominent ears. It is designed to recreate folds in the ears that are sometimes a little bit shallow, and it is also intended to pin the ear or suture the ear closer to the head so that the ear is not as prominent. This is a commonly performed procedure in our practice, and our patients are very happy with the results. Thank you for watching.